And welcome back. Now, this morning, the country wakes up to 1,716 new confirmed COVID-19 cases reported from the last 24-hour testing cycle, which effectively brings the total number of confirmed infections to date to 32,683. The Health Department has also confirmed that 40 more COVID-19 related deaths have been recorded, bringing the total number of deaths in the country to 683. And there have, however, been 16,809 recoveries, which brings the total number of active cases to 15,191. But what do these numbers really mean? And how are we, as the general public, supposed to interpret them? Well, to help us unpack and understand what all of this means, the infection trends in the country, etc., we are now joined via Zoom by a health expert, Dr. Fundile Nyati. Thanks so much for your time and for speaking to us on Morning Live, Dr. Nyati.
Good morning, and morning to your viewers.
Firstly, Dr. Nyati, looking at the latest statistics, 1,716 new confirmed cases. Should we be alarmed as a nation?
Well, I think we obviously must be concerned because earlier in the pandemic within South Africa, we were talking about if we get more than 100 cases, then they'll extend the lockdown, but we're aiming for something less than 50. So we're talking here now 1,716. That's way beyond that. So yes, we are now entering the peak that we've been talking about. We've managed to delay it with the lockdown, but we can't delay it forever. So yes, we need to be concerned, especially what is happening in the Western Cape.
So against that backdrop and with what you've just mentioned, and this is what we were told at the onset, that if we had more than 100 infections per day, then we perhaps would not be moving to lower levels of the lockdown. And coupled with the experience that you have as a health expert, is it really a well thought out decision to move the country to level 3 as of today?
Well, I think it was a difficult balancing act, I guess, for the National, Command Council, because there's two issues that are competing here. The issues of the lives that need to be saved, but also the issues of livelihood. And for the past, 8 weeks or so, issues of saving lives have taken precedence, but we can't, close the economy forever. And so what we are seeing then starting today is that we are bringing the economy, issues of livelihood to the fore to balance them. So we have to now, navigate that tight path of lives and livelihoods. And it's not going to be an easy path. And with more people going back to work, people going to church, people going to schools, we certainly are going to see a bigger spike in terms of the infections, across the country.
So what exactly is the role of science in an instance like this, where you have competing interests being brought to bear on the government?
Well, for the first, 6 weeks or so, science, was the one that was guiding everything. But that it started to hurt in terms of the socio-economic, challenges on the ground. Some political parties started making noise about the fact that, we are not going to be able to recover if we don't open up our economy. So now it's not only health sciences that are actually dictating, but also economic sciences and other social sciences. And so it's a balance now, rather than, having just medical or health sciences dictating the direction. And I guess that's something that has to be done, because at the end of the day, we can't close everything forever. The vaccine is still about a year to 18 months to go, so we can't close everything up until that time. And we also know that the majority of people who do get infected, at least about 80% of those do not really get any serious infection. And so we are almost taking a risk with that 80% of people. But then we know that there's a 20% who might get a serious infection and might even die. And that is the bigger worry. So there's an element of playing a Russian roulette with the strategy that we're following now. But I guess that's something that has to be to happen. And those who do get infected and don't get serious infections, they will acquire immunity, and that will be good. But then for those who are high risk and who get infected, unfortunately, some of those we may lose.
And the question then becomes, Dr. Nyati, whether whatever strategy it is that you eventually decide to adopt should be done at the optimal time for it to yield optimal results. And given that we are perhaps at our most infectious state right now, is that the best time to play Russian roulette?
Well, look, if we look at the fact that we are starting, only last week we had our coldest days. So our winter is only starting now. And we're going to have a flu coming in. And we also know, looking at our, northern hemisphere, or the countries in the northern hemisphere, the winter is not the best time, to deal with this COVID-19. And so we are going to have a serious challenge. But we have to try and educate and ensure that every South African, they play their part in terms of social distancing, the preventative measures, and also the workplaces must do their part, and also the schools and the churches. So we unfortunately cannot postpone for the next 2 months because our winter starts becoming better from the end of July, but that's too late. By that time, our economy would not be able to recover.
Dr. Nyati, let's just zoom in on some of the statistics right now. 32,683, the number of total cases, but in there we have 15,191 active cases. So yes, what does that mean in layman's terms?
All right, in layman's terms, what it means is that as much as we have 32,683 cases that were confirmed through, specific tests for COVID-19. Now, these 15,191 active cases, who make up about just about 48%, they are actually cases that are still having the virus in their bodies. They have not yet cleared the virus in their bodies. So as a result, they are potentially infectious.
So what does recoveries mean?
Recovery, it's those people who've been diagnosed before, who have had the infection, and their bodies have now cleared the virus from their system. And as a result, the 2 tests that have been done by the labs are showing that there's no longer evidence of active infection in their bodies.
And given that there is still no vaccine for COVID-19 yet, these recoveries, can they possibly be reinfected?
Look, I think one thing we must remember is that this virus has only been around for just about 5 months. So certain trends we do not know. However, research that has been done elsewhere, people who've had the pandemic before us, it's showing that after one has got the infection, you do get some form of immunity, to the virus. What we do not know is how long is that immunity. So there's something that is called IgG, immunoglobulin G. So a number of people who have recovered from the infection, they have shown evidence of IgG antibodies in their bodies, meaning they actually have some form of protection. But what we don't know is whether this is going to be for 6 months or for a year or, its lifetime.
And then just to talk to some of the provinces, Dr. Nyati, and we are putting up some graphics just to take the viewers with us. So if we look at the Western and Eastern Cape, for example, and we see the escalation in numbers of infections there, what can we ascribe that to?
Well, I think let's start with the Western Cape. The Western Cape, at this moment, they have about 65% of the total cases of the whole country. All right? The Eastern Cape, about 12%. And if you combine the 2 of them, that's about 85%. So what we see here is that the Western Cape, which is the mecca of tourism in South Africa, they most probably had a lot of imported cases before we started managing this pandemic. And, tourism being service-orientated, close contact of a lot of our workers interacting with those people. And some of those people, they stay in low socioeconomic, areas, highly populated, densely populated areas. And so they spread it around. But also, because of their being neighbors to the Eastern Cape, a lot of people from the Western Cape who came for the harvesting of the farms that farm apples, they also took that infection to the Eastern Cape. You add then the funerals in the Eastern Cape and the fact that generally people, especially in the rural areas, have not as yet practiced social distancing and all the preventative measures. We are then seeing the explosion that we are seeing in the Eastern Cape and also in the Western Cape.
And if we look at the numbers, and testing has been basically put forward as one of the reasons by the Western Cape, saying that they are perhaps testing more than other provinces. But speaking of those tests and the results that we actually put out every morning as the health department releases them every evening, we know that there's a backlog with regard to the testing. So the numbers that we actually see, what are we seeing? Are these actual numbers as they are playing out right now? Are these numbers from, say, when March, April, even May that are now coming to the fore? Or is it a combination of numbers? What exactly are we looking at, Dr. Nyati?
Look, you're right by saying there is a backlog. Somewhere, I would say between 50 and 80,000, the backlog nationally. So yes, that is a problem. However, we need to analyze what we have now. And that backlog is really for about, a week to two of cases. So when we analyze what we have, the Western Cape by far has tested the most number of people per 100,000 population. So they are very efficient when it comes to testing. However, analyzing the numbers purely from the test doesn't give you the true picture. Like I've mentioned, there is a high rate of a spread of the infection in the province. And that actually started even before they became the number one province in terms of the cases. If you looked at the number of cases per 100,000 population, they already had more cases, even more than Gauteng, which had more cases just in pure numbers. So we have a serious problem in the Western Cape. They are ahead of all the other provinces in terms of, the pandemic. However, what we see in the Western Cape is something that we are going to see in the other provinces as well as the winter season, progresses. So it is something that is of serious concern. And, if we, everything that we're hearing that the ICU beds and the general beds are starting to be a challenge in the Western Cape, then you even worry about places like the Eastern Cape, where the health system is actually weaker, much weaker than in the Western Cape. So we are expecting trouble. Gauteng, which had the most number of cases at the beginning, they seem to be getting things right. Their number of deaths are the lowest, if you compare for the number of cases that they have. So the two coastal provinces, and if you add KZN there, then we have a serious problem on our hands.
And is there a possible reason for that? The fact that Gauteng is recording fewer deaths than the coastal provinces?
I think it's one of those issues that our MEC here has to actually tell us, because it really doesn't tie up when you look at the numbers. Not that we want people to die, but when you look at the numbers, there is something that Gauteng is doing differently that is making them to have the numbers that they have. And I think the MEC needs to be asked that question. But yes, in terms of the health system, I think they are much better prepared than most other provinces. But in terms of why we have the lowest death rate, I am not exactly sure.
And just a final question. There are views, a school of thought that says the Western Cape is perhaps at least 4 to 6 weeks ahead of the rest of the country in terms of what they are currently dealing with. Would you concur with that, Dr. Nyati?
I would concur with that. And if you look at their trends during the month of April, their numbers were quite, they were quite low. However, when May month started, they had an explosion, exponential increase, of the numbers to a point where they right now have about 21,103 cases, and they've got about 488 deaths. And they've got about 52.6% of people who have recovered, which is actually good, in line with the picture that one is seeing for the rest of the country. But every 12 days, there's a doubling of the number of cases in the Western Cape, new cases, and also doubling of deaths every 9 days. So that is a big worry. And when you look at the sub-districts in the Western Cape, the Tygerberg area has got about 3,033 cases, Khayelitsha 2,566, Klapfontein 2,481, Southern 2252. So the bulk, almost 80% of the cases in the Western Cape is actually Cape Town and the surrounds. And if you look at, it's mainly the black townships having the most number of cases, and that reflects, social circumstances in those areas, poor housing, inability, poverty, and inability to have social, isolation, and all of those kind of things. So the Western Cape is in trouble. They are ahead of everyone, but what we see there is definitely going to happen in the other provinces, because those issues of shacks and informal settlements are not unique to the Western Cape.
Well, Dr. Fundile Nyati, thanks so much for your time. Health expert there, unpacking some of the coronavirus infection trends for us. And that, of course, leads us into the news, and Leanne to continue with some of the other news stories at 8.